Police in Saco have identified the man who was killed in a crash yesterday afternoon. Police say David Gerard was going southbound on Route 1 when his SUV crossed into the northbound lanes yesterday afternoon. Investigators say he hit another car and a dump truck and was killed. Reconstruction teams were called to help with the investigation. The lawyer for the man accused in a nearly 40-year-old murder case is asking the judge to step aside. Stephen Bouchard is charged with the murder of Alice Hawks in Westbrook in 1987. Bouchard's attorney filed a motion yesterday asking the presiding judge to recuse herself. He argues that the judge previously served as an assistant attorney general in the homicide unit. He believes she may have reviewed the Hawks case over the years, and he's worried about a potential conflict of interest. You may remember police arrested Bouchard in May. Bouchard's lawyer also worries about the pace of the process. The judge had promised a bail decision right after Memorial Day, but still has not ruled. And Bouchard has been in the Cumberland County Jail since late May. We are getting an update now on 3 members of the Robbins family, nearly a month after the deadly fire at the lumber mill in Searsmont. Owners of the mill, Jim and Alden Robbins, and family member Lily Robbins, have been recovering from their injuries at Massachusetts General Hospital in Boston. In an update today, a Mass General Brigham spokesperson said 2 of them remain in critical condition. A 3rd person has been upgraded to serious condition. Hospital staff did not share whose condition changed. As for the 4 patients who remain at Maine Medical Center in Portland, help is coming from many directions. The Portland Firefighters Children's Burn Foundation has been collecting donations for the victims and their families who have spent the last 4 weeks at the hospital. The donations help them pay for meals, hotels, and more after weeks away from home. Firefighters say burn injuries change more than the survivor's physical appearance, but their self-esteem too.
There for them. It's not a broken arm, it's not a hidden injury, and so the behavioral health side of it is huge in how to navigate society and stares and comments and in building that confidence, strength in the burn survivor to interact in public as they had before or as close to as they had before.
Now, coming up at 6, we'll introduce you to one of the families these firefighters are helping and how they are reaching dozens of other burn survivors every year. More than 100 EMS agencies across Maine are facing a major change in how they access critical medications. Maine Health and Northern Light Health are ending long-standing agreements that supplied controlled substances to EMS crews. The hospitals say it's all due to a new Drug Enforcement Agency policy. As CENTER Maine's Drew Peters shows us, local departments say they'll have to shoulder the cost and the responsibility themselves.
We have fentanyl, which we use for pain management.
These little vials are what help Leamington Fire and EMS Deputy Chief Corin Meehan and his team save lives.
Whether it's a mental health emergency or traumatic injury that's producing that.
Moving forward, though, they're going to cost him a whole lot more.
A significant financial impact that we have not budgeted for.
That's because Maine Health, which normally supplies the department with controlled medications, is ending its contract with them and around 90 other EMS providers in order to align with a newly implemented DEA law. A Maine Health representative writing in part, after extensive review of the law, regulations, and guidance, Maine Health and other healthcare systems have concluded that the requirement for EMS agencies to obtain and manage controlled substances under their own DEA registration is not optional.
That was quite a surprise to us, obviously, because we had been previously told that nothing would change.
A surprise that Meehan says comes with a nearly $30,000 price tag to buy the proper storage for the medication, which doesn't include the cost of having to purchase his own vials in bulk, or the time it will take for crews to log each time one is used.
Going forward, we're probably going to have to increase that and start stocking extra medications on the ambulances so that way we're not out of service after transferring care at the hospital.
Staff with Northern Light Health say they're also ending their medication supply contracts with around 50 EMS providers due to the new policy. But in a statement from DEA New England, representatives argue the change simply gives EMS agencies another option to ensure their medication is properly handled, writing in part, EMS agencies can still operate under the direction and DEA registration of a medical director or a hospital for purchasing needed controlled substances. The contracts remain terminated, and Windham Fire Chief Brent Libby says his department is still having to spend around $30,000 to get the needed medication.
It'll probably take us a good year or two to actually level out and make sure that we're covering everything that we need.
And while his municipality has a bigger budget to help support the expenses, he says others like Meehan's may not be so lucky. Drew Peters, News Center, Maine.
Now, representatives from Maine Health, Northern Light Health, and the DEA New England say their staff are dedicated to helping EMS providers navigate this registration process. The deadlines for the providers to come into compliance with the new policy is July 14th.